Folks, welcome to Creating New Healthcare. I am excited to have Dr. Padmaja Patel on the show. It's taking quite a few months to finally schedule it. She is one very, very busy physician and healthcare leader. I'm not going to read you her CV, but just a couple of items. She is president of the American College of Lifestyle Medicine. She is the chief medical officer at a company called Nudj Health, NUDJ, Nudj Health. She's president of the Midland Quality Alliance, chair of the quality committee at ACO REACH. She's founding chair of the clinical practice and quality committee. And she is an internal medicine physician who herself is boarded in lifestyle medicine. And Padmaja, I am so excited to have you here. Can I call you that, or is it Dr. Patel? What
Yes.
do you prefer? Um,
No, Padmaja is perfect. And thank you, Zev,
Padmaja.
for, first of all, thank you for your patience. Thank you while we were trying to coordinate our schedules. And what a joy. It's my pleasure to be with you here today. And I look forward to our conversation.
You opened up by saying something to me very personal about how learning about lifestyle medicine and becoming involved in it has really, opened up your professional career, kind of rejuvenated you. And we know, at least half of physicians, experience this thing we call burnout. I've seen it. I've seen it in my colleagues. I've seen the literature. I'm curious, again, just on a very personal level, as a physician in practice, because there are folks who are practicing clinicians who listen to the podcast. What is it about lifestyle medicine that has sort of become a renaissance for you in terms of providing healthcare or being in the healthcare field?
Yes, yes. And that's such an important question for me personally. I say that because, for my 15, 20 years of my clinical practice, I worked as an internal medicine clinician in private practice. And I found out about lifestyle medicine just about 10 years ago. And I would say it changed not only my professional sort of trajectory, but also personal, because it brought me a lot of joy and passion into my work again. It it literally brought me, what we call as joy in medicine,
Mm,
because the kind of patient outcomes that you now see because you implement lifestyle medicine. I never
mm,
saw that in my traditional primary care practice. So all of that really transformed how I viewed patient, not just looking at sort of risk factors, but really addressing root causes of chronic
mm,
conditions and empowering patients. There was this shared decision making. Yeah, you're really encouraging and helping patients on this behavioral health journey.
mm,
All of those were sort of a new concept for me. And
mm,
I love the team-based care,
mm.
bringing not just, um, you know, dietitians, health coaches, social worker, and the entire team that can support patients on this health behavior journey. So all of these brought joy for me, but also able to demonstrate the value of lifestyle medicine has been kind of passion for me. I really enjoy that, not only clinical outcomes,
Mhm,
but also cost savings, improving patient experience,
mhm.
and so forth.
It sounds like it's a return to the core professional purpose of
Yes.
primary care. That's really what it sounds like. A couple of quick questions. And so how many physicians are there that are board certified across the country in lifestyle medicine? Because it is a board certification now.
Yes. Yeah. So we now have board certification since 2018.
Hmm.
And globally, more than 10,000 health professionals have certified. And I would say as approximately 8,000 physicians
Hmm.
are certified in lifestyle medicine across the world. So again, it's not just a US phenomenon. It's
Wow,
truly lifestyle medicine is a global
that's
sort
great.
of phenomenon. Yes,
Mm,
there are countries around, and we have, as
mm,
ACLM, we have members from 95 countries around the world as our
Wow.
members. Yes, it's like half the world. But there are societies now
To know
across
that.
the world. They are forming lifestyle medicine societies across many countries and are learning and implementing clinical practice into and also around population health strategies.
And what type of physicians or other types of providers can actually get board certified?
Yeah, so if you look at our membership,
Hmm.
we have about 65% members are MDDOs. A
Hmm.
majority of them are, I would say, primary care clinicians, but we
Hmm.
have specialty clinicians, specialists from across all specialties and disciplines.
Hmm. Hmm.
You think about cardiology,
Sure.
orthopedics, dermatology, and so forth.
Wow.
But we also have
Hmm.
the entire interprofessional team as part of our members as well. So, registered dietitians, health coaches, social worker, OT, PT, you name it. So the entire interprofessional team
Hmm.
is also part of our membership. And that's such a
Yeah.
unique membership model that we have, which
Yeah.
truly represents the interprofessional field of lifestyle medicine.
So I have a feeling that a lot of folks who are listening are asking themselves the question and wondering when I'm going to get to this question of, so what is lifestyle medicine?
Yeah.
What, and I'm curious because, we have holistic medicine, integrative medicine, functional medicine, all these terms. Can you give us a picture of what does lifestyle medicine focus on, and how is it different than, let's say, a regular primary care provider?
Yeah, I love that question because, yeah, people tend to confuse the terminologies here.
Mm,
But I would say lifestyle medicine is a medical specialty that uses evidence-based therapeutic lifestyle interventions as a primary modality to treat chronic conditions. And when we use these interventions intensively, we often put chronic disease into remission.
mm,
So I would say and I think we just talked about how I sort of transitioned from internal medicine practice to more as a lifestyle medicine clinician. And
mm.
the changes that I experienced, and I would
Yeah.
say
Yeah.
predominantly were around the mindset. As we
Mhm,
say in as an internist, we are always focusing on risk factors. Instead,
mhm,
in lifestyle medicine, we are focusing on root causes of
mm,
chronic conditions. So there's this approach is so different. Um, in traditional primary care, I was giving prescriptions that focus on diagnosis, disease management, making sure
mhm,
there's compliance to treatment,
mm,
refills are given, and then the burden of the care is on me as a clinician.
mhm,
Whereas in lifestyle medicine, that approach is so different. Patients are active partners. They're equally involved in their own care team, care plan. And then often we include interdisciplinary team as
mhm,
part of care management. So that supports patient when it comes to nutrition, physical activity. So the six pillars as we talk about of
mhm,
lifestyle medicine is what we focus on as a therapeutic intervention. And again, we do prescribe medications,
mhm.
but using lifestyle interventions as a first line, just as recommended in many clinical practice guidelines. So I would say the approach is different in the sense you are focusing more on addressing the root causes, and you do use medication more as needed basis, not just as a first line of intervention for every patient that walks in your clinic. And you provide that
Mm,
ongoing support and making sure there is a team that supports you as a clinician. So
yeah.
it's sort of a team sport.
Yeah.
But I would
Yeah.
say, I'm not an expert in functional medicine or integrative medicine, so I don't want to talk about what that is, but I can say confidently that lifestyle medicine is rooted in evidence-based
Mhm,
research and guidelines. If you look at the clinical practice guidelines for many chronic conditions, such as diabetes, hypertension, heart disease, cancer, dementia. They all recommend lifestyle interventions as a first line of treatment. So all we have done is brought these 6 pillars into that first line of treatment.
Mm-hmm.
And then, of course, we use medication sort of more as needed basis. So I would say this is sort of rooted in guidelines and science and evidence. Many of these integrative and functional medicine clinicians do use lifestyle medicine more as a foundation of their treatment as well.
Yeah.
But we don't prescribe supplements. We don't focus on
Mm-hmm.
all other modalities of treatment that are not necessarily evidence-based. And we also don't order a lot of blood tests or routine panels of testing that's not necessarily part of our care plan as well.
That's super helpful. Thank you, Dr. Patel. The you kept on talking about root causes, and so what do you focus on? And I'm curious because you said there was a Dr. Patel before lifestyle medicine, and there was a Dr. Patel after. And so, what does the Dr. Patel after and the others who are board certified? What do you focus on? What are those root causes? And for folks, just a fun fact, which I actually pulled off of one of your websites. I'm not even sure which one, Dr. Patel, but um, over 80% of chronic diseases are impacted or caused by modifiable. That is, we
Yes.
can change them, lifestyle behaviors. That is something I think most people are unaware of. That's a
Yeah.
pretty significant statistic. And so you're focusing on these, I assume, these modifiable lifestyle
Yes.
behaviors. So I'm curious what they are. What do you focus on?
Yeah. So, and also, as I wanted to finish that statement, which you just said, 80% of the chronic diseases are sort of rooted in this modifiable risk factors, but also 90% of healthcare spending is in managing chronic physical and mental chronic conditions, right? So here we are as a nation trying to figure out, where do we cut the cost? And
Mm-hmm.
it clearly makes sense when you have something where you can impact 80% of chronic conditions, which are simple choices we make every day, right? So I think often this connection between simple choices we make, such as what we eat, how much we exercise, how much we sleep, how we handle stress, whether or not we smoke,
Mm-hmm.
all of these simple choices can contribute to our health
Mm-hmm.
or can cause us, the chronic conditions that we suffer from. But we can
Mm-hmm.
also use these as a therapeutic intervention to sort of reverse or put this chronic disease into remission. And I think that connection
Mm-hmm.
of the choices with the conditions we suffer from is where we lack. I think even as a so often
Mm-hmm.
medical clinician and as a training
Right.
is I think that is something that we never learned as part of our medical
Right.
education. So we haven't completely ignored this what we call as a root causes, which are the 6 pillars, which is optimal nutrition, physical activity, restorative sleep, stress management, avoiding risky substances, and positive social connection. So these
Mm-hmm.
are, 6 pillars that we heavily focus
I love
on
it.
and use them more as a
Yeah.
intervention therapeutically. And again, based on the dose and intensity
Mm-hmm.
of the intervention, we see whether we can put chronic disease into remission, whether we can improve, pharmacy or medication
Mm-hmm.
de-escalation or de-prescribing, and really empower patients on this health behavior journey.
So a lot of folks are going to be thinking, and myself included, that you go to primary care physicians, and exactly what you said. Most physicians, including primary care physicians, have not been trained in any of these pillars, right? And so, typically the provider, the doctor will say, you have to lose weight, you're overweight
Yeah.
or this or
Yeah.
that, and
Eat
and
better and exercise more.
eat better, exercise. Okay, thank you very much. That doesn't really help me. So,
No.
or you refer to a nutritionist, let's say. But so, what happens in the lifestyle medicine board certification or training? Again, going from the Dr.
Yeah.
Patel before to the after,
Yeah.
how were you better equipped? Is it, a combination? And also, is it that you spent more time in your visits? Like, what did your visits, the difference between your visit now as a lifestyle medicine practitioner versus a regular internal medicine or family medicine practitioner?
Yes, and that's the sort of the crux of how we can really change patient
Mhm.
care is obviously the training, education is a critical piece, but also the care delivery. How do you treat patients? So first and foremost, what we do, as most clinicians, lifestyle medicine train, is we use the screening tools to really assess patient
Mhm.
into the six health behaviors, and really come up with the plan, working together to really identifiable, to figure out what are the steps we can help patient to optimize those lifestyle behaviors.
Mhm.
And then what we call is a lifestyle prescription. So we
Mhm.
really create a very concrete action plan using the SMART goals for each pillar and give that to patient, before they leave healthcare intersection. So it's not
Mhm.
just sort of a vague advice that eat better and exercise
Right.
more. There's a real goal and prescription, and so patients take
Mhm.
that as seriously as a therapeutic
Mhm.
medication that you prescribe. So
Mhm.
there is that emphasis on
Mhm.
adhering to this care plan. And then often what we do use is a cohort-based interventions, which means what we call a shared medical appointment or group visits,
Mhm.
where a group of patients come together with
Mhm.
the healthcare teams for education, goal setting, and ongoing support.
Mhm.
So that is a very popular model that works really well. Often we bring patients with the similar
Mhm.
diagnosis or sometimes
Right.
multiple chronic conditions, and then bring in, either registered dietitian, health coaches within that shared medical appointment
Yeah.
visit, and create that community. Here you have now a group of patients that, learn
Yeah.
from each other, but also, you have the same information that instead of having to
Mhm.
treat one
Yeah.
patient at a time, you're now bringing 10, 12, 15 patients in a group
Mhm.
setting. So shared medical appointment is another very powerful way we deliver our lifestyle interventions. And
Mhm.
then ongoing monitoring, making sure, your pre and post intervention, capturing data, clinical outcomes to make sure that patients are, improving, biometrics and
Mhm.
capturing that as well. So that's the approach is instead of seeing one-on-one and just prescribing and
Mhm.
refilling prescription, now you have a very different approach
Mhm.
to
Mhm.
addressing those root causes of chronic conditions, but also bringing interdisciplinary team into
Mhm.
this, what we call as a cohort-based interventions.
So, how do you have the time to do this? Because, again, one complaint a lot of folks have about primary care is, the doctor really doesn't know a lot about nutrition. So the
Yes.
American Board of College of Lifestyle Medicine, to sort of solve for that, you provide clinicians with the knowledge and now tools like assessment tools.
Hmm.
I suspect you teach them how to do shared medical appointments. You teach
Yes.
them how to work as an interdisciplinary team. Again, these are highly differentiating from typical primary care. So really appreciate that. But the other big complaint folks have is, and I would say doctors have this complaint or providers have this complaint as well, is that I can't afford to have longer visits where I get, to know the patient and do the things you're talking about. Um, I do have a background in shared medical appointments. I launched many of them back in the day, and with Ed Nofsinger, who created the model out of Kaiser.
Yes.
And so he and I worked together very closely for about 3 or 4 years in Boston. And I had about 50 or so shared medical appointments in not only primary care but in specialties. They actually work exceptionally well in specialties.
Yes.
It was really inspiring to listen to these participate in these shared medical appointments. But The problem is or still financial. How do you either with the individual appointments or the shared medical appointments, how does payment work for these? Who's paying for this amount of time for you to sit? I mean, a physician's a costly, expensive asset in primary care or in medicine. So how does that work?
Yeah, and as you just said, shared medical appointments have, at least our members, we've seen not only in primary care, but even specialty clinicians have been embedding them into their care model. So the way it
I love that.
works currently is, again, billing typical E&M codes,
Mm,
which is 99213 or 214 for individual patient. And instead of spending one-on-one office visit, which you would spend what, 15, 20 minutes, you have about 12 to 15 patients within your 90-minute slot.
mm,
So you could really create a financially viable model by just adding a group visits in your schedule. And
mm.
and that allows not only, improves
That's great.
access to patients, but it also allows you to see more patients. And and I'm sure you've had the experience in shared medical appointments, so but any given day, I prefer group visits than one-on-one. There's
Yeah,
just the chemistry, the fun that you have with meeting the group and
yeah,
learning about their journey. It's just
yeah.
so empowering and encouraging.
Question about outcomes. So I imagine there's a lot of research indirectly supporting lifestyle medicine. Dean Ornish's work is just one example of that. But can you provide just a couple of examples of some of the research that if someone would ask, what evidence do you have that this actually works better than, let's say, not using lifestyle medicine?
Yeah, yeah. And I mean, you can look at the clinical practice guidelines, they don't come up with lifestyle interventions without any evidence, to be honest. But
Hmm.
evidence is overwhelming. As you can see,
Yeah.
whether you look at the inter-heart study, inter-stroke study, way back when, almost 90% of the first heart attack or MI, is attributable to 9 modifiable risk factors. So the
Hmm.
lifestyle factors and chronic disease have been, the correlation has been there. But think about, as you said, randomized control trial of Dean Ornish looking at the cardiac patient and hopefully, heart disease remission. He's also now shown some early improvement in cognition in dementia patients. So I think that is also something to think about.
Hmm.
But then what about, you talk about the diabetes patients and diabetes remission
Hmm.
in direct trial, right? Type 2 diabetics, almost 46% remission in 1 year
Hmm.
with the dietary intervention.
Hmm.
So, and if you look at the meta-analysis of many, that consistently shows that lifestyle interventions reduce all-cause mortality. So I would say evidence is overwhelming and it's there. But
Right.
most importantly, what excites all of us
Hmm.
is what we see every day
Mm.
in our own practice. And some of these things we're literally, may or may not have been published, the data, but what we are seeing is amazing. Some of the neurological conditions improving. So my, story I want to say is the the support I got locally in my own health system had a lot to do with my administrative leader who was recently diagnosed with multiple sclerosis. As we were talking about lifestyle
Mm.
medicine at the system levels, she learned about it. She immediately made, changes to her lifestyle,
Mm.
and her symptoms completely got into remission, and she's still in remission after 8 years. If you look at her MRI, she had a lesion in her brain,
Mm.
which actually
Wow.
showed a follow-up MRI scan, complete resolution of that. So, and what I'm
Wow.
trying to
Wow.
emphasize is that there are
Yeah.
patient stories and the success of lifestyle
Mm.
interventions that we see on a regular basis from our patients, and even
Mm.
through my work through Nudj, the outcomes data that we continue to track on a regular basis. It's just
Mm.
incredible and impressive. And this is what drives our membership. I would say, in
Mm.
last since 2019, our membership has tripled. I mean, that's unheard of,
That's
any
crazy.
medical
Wow.
professional society. And I think what drives that is the success of what you see, the joy of medicine. People are so burnt out and tired of this current system, and they're finding finally something that works.
Mm,
And I think this is what is exciting for the field, but obviously clearly rooted in evidence and clinical practice, which
mhm.
supports
Yeah.
patient empowerment and what we call as a quintuple aim of healthcare. We really help health plans and employers and health systems to really get to that level where we're not just talking about improving
Mm,
clinical outcomes, but financial ROI and really
mm.
demonstrating the value of lifestyle interventions.
No, that's fantastic. Um, Given the emergence or with the emergence of GLP-1s
Yeah.
and other similar medications now, like tirzepatide and others like that, and there's more emerging. There are these, I'm curious how you see, I mean, it is obviously huge and emerging and growing, and there's a lot of evidence to support the use of these medications in heart disease, diabetes, obesity. Oh, how is lifestyle medicine adapting to and including the use of those medications? Just, I'm sure people are thinking that. I'm thinking that. Yeah.
Yeah, I don't think there's a question of or. I think we look at more as
Mm,
and,
right.
which means we believe there is a clear role for these medications for the right population. Where
Exactly.
lifestyle medicine plays a role is more about how do we support these members who go through this, expensive medications
Hmm.
long term and a sustainable goals that they want to achieve. So I think this is where we see a big role of lifestyle medicine is to often maybe before they get started on treatment, while they are on treatment, but
Hmm.
also once they're successfully, off medications to continue to maintain what they have achieved. Lifestyle interventions play a big role. And obviously they're recommended. If you look at the
Right.
GLP-1, you know,
Absolutely.
the FDA, yes. So somehow or the other, we've thought that this is, either or. I think it's more about the question of
I
and.
I
Yeah.
think I think you're spot on. I would see it as a both and. Um, Technology.
Hmm.
Uh, as you know, in the last lifestyle medicine has been around for a while. AI has not. It's just emerging as well in the last couple of years in a big, big way. How is lifestyle medicine adapting some of the technology? And I know it's still early on, but just kind of curious about that.
Yeah, I am personally very excited for technology to embed technology in a variety of ways. But we have seen, in terms of administrative tasks and, the AI notes and clinical
Mm,
documentation, those are all great stuff. But I think there's a bigger role when it comes to patient
mhm,
empowerment and
mhm,
engagement. Really, AI can help us personalize all this information from patient variables, patient
mhm,
personal feedback, and really synthesizing all of these into
mhm,
creating nudges, right? Very right messages and prompting patients on their behavioral health journey, but also making sure that that is sort of plugged into the EMR, I would say. Sort of there's bidirectional flow, so the care team and a PCP is still on
mhm,
sort of have the oversight of what's happening with the patient. So I
mhm,
think that would be the ideal model that I would like to see it someday, where AI is really helping patients, but then supporting the journey along the health behavior individual, so all six pillars that we talk about, and giving that personalized nudges and helping them move the
mhm.
needle, but also keeping the clinicians into the supervising role. So there is that hybrid model that I would love to see
Yeah.
clinician plus AI.
Have you? I completely agree with you. I think I mean, AI is going to affect healthcare in so many different ways. Right now, and I've talked to folks who come from the wearable industry. Right now, it seems very, very much focused on data and
Right.
providing data, which I think plays a role. But the real challenge is, and I use this, just my own personal example. I mean, it was great to see my heart rate variability once or twice.
Yeah.
By the third month, I was like, you know what, this is not really helping me. I know when I wake up in the morning and I feel like crap, because I didn't sleep or I had too many glasses of wine or I ate
Yeah.
too many carbs. I know I don't feel well. I don't need you to tell me, you don't feel well. Thank you very much. But I think where the real help would be is exactly where you're suggesting it in the future is that it's how can the intelligence actually help me in my everyday behavior? To your point, these
Yes.
behavioral nudges, the habit formation, the
Right.
reminders. How can it create that environment, a more healthful environment for me? I think that is the future. I'm curious what you think about that.
Yeah, no, that is the direction I think we need to go. And personalized nudges. Generic information is not good. Like no one wants to listen to
Right,
that standard
right.
advice. And I think more personal messaging and
Mm-hmm,
nudging there is. Also, I wanted to say the
mm-hmm,
new payment structure that just was announced last week on access model.
mm-hmm,
If you look at the CMMI's payment models for those managing chronic conditions for all those tech-enabled companies,
mm-hmm,
it's a clear indication that they're wanting AI to be embedded because payments are so,
mm-hmm,
small that only technology can perhaps take care of it. So there's a
mm-hmm.
clear indication that that's the direction we need to go to
Right.
reduce total cost of care.
Yeah, no, that's fantastic. Um, if I'm a physician and I want to learn more about this, and I can't imagine any physician who's listening to this who doesn't want to learn more. You do a great job, and it's lifestyle medicine is fantastic. Where can I go to find out more about the board?
Yeah.
Yeah.
Yeah, so please check out American College of Lifestyle Medicine. And we have obviously, CE, CME courses, webinars, board certification at American Board of Lifestyle Medicine, ABLM. And we also have ongoing webinars that you can sort of, tune in anytime. As a member, we create incredible resources to support our members in clinical practice,
Mm,
practice transformation, payment, reimbursement, guidance, and so forth. So that's another avenue to think about. Our annual conferences, I want to say, it's a really amazing
mm,
way to get to experience what lifestyle medicine is. We gather anywhere about 2,500 people in person, another 3,000 joining virtually. So it's a hybrid sort of conference for about
nice.
5,500 people annually joining us. And that's another way to sort of get the experience of what lifestyle medicine is. But yeah, I would say check out our website. I think that brings
I
a
would do
lot
it.
of new resources
And
there.
and if I'm listening as with my patient hat on, and I want to find a clinician who's certified, board certified in lifestyle medicine, is there a way for me to do that?
Yes, so ACLM, again, American College of Lifestyle Medicine has a portal where you can actually search clinician certified in lifestyle
That's great.
medicine through a zip code. So that helps you find the right clinician for your care.
So, Dr. Patel, what is next for the American College of Lifestyle Medicine? Where do you see it going in the next 3 to 5 years?
Yeah, it's a fantastic journey we are on right now. I say, we have incredible momentum, exciting opportunities that have come through the CMMI models, and now that the members will be participating in these demonstration models to really prove the payment structure eventually, right? So our hope is that Maha Elevate, which gives us $100 million grant to test 30 models of lifestyle interventions. So we're very excited for that opportunity. ACLM is also working with many stakeholders, including NAC, which is National Association of Community Health Centers, which is the
Hmm.
biggest, primary care organization nationally. So to really embed lifestyle medicine within FQHCs and CHCs across the country. So we have many stakeholders, including 120 health systems, and that list is growing, which have joined ACLM,
Hmm.
again, to implement lifestyle medicine at a systems level. And then we have a small group of what we call the Innovators Council, which is the risk-bearing entities, ACOs, health plans,
That's
employers,
great.
and health systems are having a little deeper dive into
Hmm.
how do you train your healthcare teams? How do you
Hmm.
embed lifestyle medicine clinical models and really bringing leadership
Hmm.
alignment across there?
Hmm.
So
Hmm.
there are many ways we could continue to spread our message.
Hmm.
Advocacy and reimbursement still top is my top priority. So we'll continue to work with CMMI and CMS. Also, quality measures. I think it's one area where we haven't had a lot of luck, but we'll continue to create, because without having a aligned
Hmm.
measures,
Hmm.
it makes no sense. You could improve outcomes, but if you can't capture the value of it, the incentives will never be aligned with it. So there's a real need for us
Hmm.
to continue to advocate for that. So I see in 5 years, I hope we can make lifestyle medicine the foundation of all health and healthcare, and making sure more clinicians are trained and certified in lifestyle medicine. That will be my dream.
That's great. I want to stay in touch with you. I'm going to be following your organization, the American College of Lifestyle Medicine, and I really think this is super exciting. This is exactly what we need in healthcare, more of a focus on lifestyle medicine for all the reasons you said. So thank you for your time. I know how busy you are, and I hope we have a chance to talk again soon.
Thank you so much.